Hello, how's everybody? My name is Caitlin Fowler, and today I'll be talking about amyotrophic lateral sclerosis, also known as ALS. So, what is ALS? ALS is a progressive degenerative disease that affects nerve cells in the brain and spinal cord. Amyotrophic refers to no muscle nourishment, and here's a little video I have for you. Go back to my slides. Alright, so the progression of ALS. So in the early stages, muscles may become more weak, soft, stiff, or also have muscle fasciculations, which is basically just muscle twitches. This can affect one or multiple regions. Alright, and a lot of people start to lose their balance, become easily fatigued, begin to slur their words, or lose their grip. This stage may occur prior to diagnosis. So in the middle stages, this is where the symptoms become more widespread. Some muscles begin to become paralyzed, while others are either still weak or unaffected. This is where a lot of people start losing their ability to do the activities of daily living, so they're going to need help and they're not going to be able to drive anymore. And also they will start losing their weakness in swallowing. And in the late stages, this is where most muscles are paralyzed, muscles of breathing become severely compromised, and this is where speech, eating, or drinking may not be possible. So respiratory insufficiency is the leading cause of death in ALS. People can no longer breathe because your throat has muscles in them, and those muscles are going to be affected as well. But death is also caused by malnutrition due to not being able to swallow, abnormal heart rhythms, and pneumonia. And this is when fluid or food gets stuck in the lungs. Hospice care is available. So this is just a little rundown. So ALS will begin in the brain and spinal cord, and that is where your motor neurons are held. So this is the signal to your muscles to move. And if those neurons are degenerating and dying, you're not going to be able to move. So some symptoms of ALS are kind of like what I said. It's very varied, so it's going to be different from person to person. Of course, it's going to be loss of motor control in the hands and arms, twitching and cramping of muscles, especially in the hands and feet, persistent fatigue, and difficulty speaking or vocal cord spasms. I'll just give you a little example of leg fasciculations. Just little baby twitches. Let's go back. Alright, so here's just some examples, and right over here you will see the normal, healthy motor neuron where it fully innervates the muscle and is able to send that signal, while the affected nerve on the right side is not fully innervating that muscle, and that signal can't be given to that muscle to move. So the diagnosis of ALS, they go by 3 specific criteria. This is the signs of degeneration in the lower motor neurons, the upper motor neurons, and then progressive spread throughout the body. It's often a rule-out procedure, so this means that they will test you for other diseases or disorders that may have similar symptoms by doing like a blood test or something like that. So they're going to rule out everything else before they diagnose you with ALS. So the effect of ALS on the exercise response. highly controversial, all right? So those professional football or soccer players, when they go at that intense for that long, that frequently, that is, they say that that may cause ALS because you're constantly inflamed. You got a lot of stress and glutamate exotoxicity. These are all mechanisms of cell degeneration. However, light to moderate exercise has been shown to be beneficial to those who are already diagnosed with the disease. So there was a study done in mice that showed high endurance training is detrimental. However, there has been increased synaptic density, neurogenesis, which is the formation of neurons, and neuron differentiation and survival for light to moderate exercise. I don't know. All right. So, decreased loss of motor function, fatigue, and pain after 6 months in ALS patients has been observed after doing light to moderate exercise. And then there's often stretching, resistance, or concurrent training that's done with these individuals. So management and meds. There's, of course, I said in the beginning, there's no known cure to ALS. However, there are support groups available, and there's 2 FDA-approved medications. It's Riluzole and Radicava. These medications will relieve discomfort, anxiety, and fear, and of course, the support groups will help with that as well. And that's just this is an example of Riluzole, and that's just the picture of what it is. All right, so here's my case study. So Mark Davis is a 64-year-old man who has recently been diagnosed with ALS. The doctor prescribed him Riluzole to manage anxiety, fear, and chronic pain. He has recently retired from working as a construction laborer, but otherwise lives a sedentary lifestyle. He does not have a history of smoking, but his father died from myocardial infarction at the age of 60, also known as heart attack. He has no signs of cardiorespiratory disease. He has just completed a body checkup, and the report showed a body height of 6'3" and a body weight of 175 pounds. His BMI is normal at 21.9, and the blood test showed total cholesterol of 150, his LDL levels of 85, and his HDL of 65. His fasting glucose is also good at 85. His blood pressure is 130/80, which is great as well. So his level of risk is low to moderate, just because of the effects Riluzole has on it, has on the exercise response, which is dizziness, lightheadedness, loss of appetite, muscle stiffness, and increased blood pressure. So we gotta watch out for that. His goal, Mark's goal, is to delay the gradual paralysis effect of ALS, decrease pain, and increase his strength and range of motion, as well as increase cardiorespiratory function. All right, exercise testing. So, as a exercise professional, I would want to set a baseline for all of the components of fitness, which is cardiovascular, strength, endurance, flexibility, and balance. I just want to kind of see where he's at, and I won't do anything too intense since he is in the early stages of ALS. So the exercise test I chose was cardiovascular, 6-minute walk, it's not too bad. Strength, I wanted to do the hand grip dynamometer, which is right to the right. And then endurance, we would just do 1-minute sit-up push-up, see how much you could get in 1 minute. For flexibility, we would do the sit and reach, and the balance, I just want to do like some one-legged standing, maybe have him on 2 legs and close his eyes, see how that goes when we get rid of that visual component to balance. Alright, so here's my exercise prescription. So I would want him to work out maybe 4 to 5 days a week. Nah, probably more like 4. But it's totally up to him how he's feeling. And of course, I'll go into the modifications later. Muscular strength training, we want to do less than or equal to 1 day per week. Intensity is going to be low, so we would do like 4 reps with 3 sets. I want to do a lot of compound exercises just to work a lot of muscle mass and just use a lot of muscles at once. So this would include squats, lunges, and bench press. Time would be 20 minutes. Muscular endurance training would be, again, less than 1 day per week, probably like 8 reps, 2 sets, or hold for 30 seconds because we're going to do some isometric exercises such as wall sits and planks. And dumbbell exercise, we'd also do like arm curls, shoulder presses, dumbbell rows, and we'd also do this for 20 minutes. Alright, so cardiovascular training, we would do less than or equal to 2 days per week. We want to do about 20 to 30% of his VO2 max, or an rate of perceived exertion of 2 to 3. We would do walking for 25 minutes. Again, I really want to emphasize flexibility because it's important to get that full range of motion in those muscles and in those joints. We do this 1 day per week. I would have him go to a yoga class, try and go maybe do 20 minutes if he does it at home. And then also for balance, I would have him send him to like a Tai Chi class, do that 1 day per week, or just like look up a YouTube video that's 10 minutes long. So contradictions and modifications. So of course with ALS patients, not every day or week is going to look the same. When he is feeling more fatigued than usual, or he's just out of it, or feeling depressed, I would send him for 10-minute intervals, so he could go for a walk in the morning, walk in the evening, and then a walk at night for 10 minutes. As the disease progresses, I want him to use lower weights and do fewer repetitions. And of course, I'm going to emphasize him to listen to his body, not overdo it, get plenty of rest. And then also stretch as much as possible just to emphasize that range of motion. So due to the side effects of Riluzole, it will be important to carefully attend to Mark and check his blood pressure before, during, and after his workout. So in conclusion, ALS is a rare neurodegenerative disease that affects nerve cells in the brain and spinal cord. ALS patients lose their ability to move, eat, swallow, etc. It's so sad. I personally don't know anyone who has ALS, but I pray to God that I don't ever meet anyone with ALS. But always be grateful for your body and the things it does for you day in and day out, because we tend to take that for granted. This is my references. And with that said,